Good evening, everyone, and I wanted to welcome you this evening. We have Dr. Justine and we have Sacchi here. Dr. Justine is our owner of Justine Blainey Wellness Center and our primary chiropractor, and she is going to be interviewing our physiotherapist, Sacchi, this evening. So I'd like you to help me welcome both of them this evening. Thank you,
Thank
Dr.
you.
Justine.
All right, Sacchi, excited about today's
Hello.
interview because we're excited to have physiotherapy and to work together as chiropractors and physiotherapists and our naturopaths, our nutritionists, everybody working together as a team. One of the first questions I wanted to ask was how did you end up getting into physiotherapy? What happened in your life that made you want to choose physiotherapy?
I think from very beginning, I was more leaning toward health, fitness, and medical field. But my mom had got rheumatoid arthritis at very early. Then we are looking for so many treatment, allopathic medications, and all those. At that time, I came to know about physiotherapy that we can manage with without any side effects. And then I was kind of first attracted to the physiotherapy. Then gradually when I joined, then knowing the field is more evolving, evidence-based, and like to be with the people, that's what made me more towards in this profession, yeah.
Awesome. And what kind of education did you have to get then? Once you graduated from high school, what did you need to do to become a physiotherapist?
After my schooling, I did a bachelor in physio and also master in physiotherapy. In masters in physiotherapy, I did specialization in sports injuries, sports rehab. And after bachelor, I was able to practice as a full-time physiotherapist, but I did masters to have more education, more little specialization in other field as well.
Excellent. So what kind of sports athletes do you like to see?
But I see a lot of athletes. Mostly I'm seeing here a lot of soccer players, runners. Recently I was seeing softball. So all type of sports injuries, especially I do treat all kind of.
And what made you choose the difference between the Justine Blainey Wellness Center one-on-one care versus choosing physiotherapy where you just supervise at a gym? What made you choose the difference?
Yeah, but I think when you are one-on-one, you see the patient, you see the development, improvement of patient every day-to-day basis, and you're kind of more knowing the lifestyle and very personalized care and very specific and goal-oriented. I like more in the one-on-one. That's why in Justine Blainey. And here in Justine Blainey Wellness Center, I found various of sports injuries I'm seeing here. As I told you, I see soccer players, I see runners, I see softball, and I see some of the coach and their kids. Then so many school students around. So I have seen so many injuries from there. That's why I enjoy that way to treat various type of sports injuries there. Yeah.
And what ages do you work with?
Basically, I work with all ages, starting from kids to the older population as well, depending on injuries and depending on making them to bringing back to functional activity, functional level. Yes, I do work with all ages. Yeah.
And what kind of conditions would you work with the athletes, but even with say the children versus the seniors? What are kind of some of the conditions you would work with?
Yes, in sports injuries, I see a lot of knee injury, let's say meniscus injuries, then ACL injuries, mostly ligaments injuries, all types of sprain, strain, sprain of any elbow sprain, wrist sprain, all kinds of sports injuries with that. And along with that, I do also treat chronic cases like arthritis. That's what I love to do because chronic cases are more challenging. because they have pain for so many months or so many years, right? So I love to take those challenges. So I see frozen shoulder, like, in those conditions, like it takes maybe years to get better, so much painful and restrictive movement. I do treat those. And along with that, I have also specialized in vestibular rehab, like dizziness, vertigo, and also balance issues. I do treat those as well. Very recently, I did concussion management. So now I'm venturing into that new field, concussion treatment. I do see some patients in that field as well. Mostly neuromuscular, but not limited to that. I do also other neurological cases as well. Yeah.
So let's delve into that a little bit, because somebody with arthritis, what would you offer them? What would you do? Say I come to you with severe arthritis of my back and my knees and my hips.
Yeah.
What would a typical treatment plan be, and how would I what would I expect if I saw you?
Yes. So we all know, like, arthritis is more like degeneration, wearing and tearing of the joint, catalyst. So as a physiotherapist, what I can do is, I know that it's progressive, right? So very basic is pain. Some patients in acute condition, there is swelling of the joint. I do like to do manual treatment to release the tightness of the muscles. Along with that, I have modalities like ultrasound therapy. I have interferential current. We have cold pack, hot pack, depending on the conditions. I do use those modalities to reduce the inflammation, reduce the pain in the beginning. That is the first stage of the treatment. Then after that, I do exercise. I know that exercise is kind of a long-term solution for this, because you have more strength in the muscles. Muscles will take the load from the joint, then there will be less degeneration. That's what is the main goal or long-term solution. So I do very specifically personalized exercise program for those patients, so that we can avoid, along with the manual technique, trying releasing, improving the joint limitation. Yes, that's how. By knowing the person, do some little bit of lifestyle modification, so that would also help for long-term management of the osteoarthritis. Yeah, or any arthritis program.
So that would be great for arthritis. It's similar for, a frozen shoulder, an injured knee, injured ankle.
Yes.
Well, how would that differ for somebody with a concussion? How would the exam be different, and how would treatment be different for a concussion?
Yes, concussion is a little bit of very different. There are so many types of concussion. One is concussion from the sports injuries. One might be concussion from the accident, like motor vehicle accident. So concussion in sports injuries, there are so many symptoms. Like with concussion injury, that might be some vestibular issues associated. That might be some musculoskeletal issues associated. First, we try to treat those parts, like relieving any musculoskeletal issue. Then any balance or vestibular issue, we treat like that. Then, depending on the situation, like what type, some are early prognosis is very better. Then some are a little bit taking more longer time. Then we have to building strength, building balance, then eye coordination. All in concussion, that's the difference. Yes, in musculoskeletal, it's definitely like building up strength. If it's a sports person, then back to the sport-specific exercises. That would be very important for the sports person. Sometimes it takes longer, but it's to prevent further injuries. That is also important. That's why a little bit of different. But yeah.
And how would that differ from someone had benign positional vertigo or BPV? It is. How would that treatment differ from, say, a sports injury?
Yes. So in BPPV, as we know that what exactly happens, there is crystals in the inner ear. When those crystals are actually essential to maintain the balance, the three-dimensional. When we move, that gives the sensation to our brain that how to maintain balance, right? First aim is to back those crystals to where they usually stays, like the ampulla. They usually stay back to there. After that, in some patients, they lose balance because, then again, training the brain to maintain the balance. That is the vestibular rehab. That part is after that. And so basically, initial stage is to do some maneuver to back the crystal into the position. Then the second part is improving the balance, training the eyes, training the movement with the balance, vestibular, and yes, the balance training is the after part.
Well, it's so important. So people know I separated my shoulders 5 times now, and definitely use physiotherapy after separated shoulders. I've also had numerous sprained ankles playing soccer, and always responded better with physiotherapy and with ultrasound on my ankles. And then I have seen patients when they have this vertigo, like they literally want to throw up. They the room spins, can barely get out of bed, or anytime they go from sitting to standing or from laying down to sitting, the room spins. They can't drive a car. They can't go to work. They can't use a computer. They can't use a phone. They can't look down. This benign positional vertigo, or vertigo, if you've had it, is debilitating. It can be absolutely debilitating if it gets severe. So it's something that, when I've seen a patient pee their pants, like literally they stood up, got so dizzy, they threw up, and they peed their pants in the examination. So definitely something that's great that we have physiotherapy and somebody that can specialize in vestibular, in vertigo, and dealing with tinnitus too. That's the ringing in the ears. It can be so annoying, affecting your ability to communicate with others, especially now with everything by Zoom and technology, even more care to take care of your brain. And I know everybody's heard about concussions, with all the hockey players with concussions and football players with concussions. We know more than we ever did before. When I had concussions, it was do you know your name, and out you go. Like, just get back on the ice, get back on the floor, you're good to go. And
so nowadays concussion is getting more popular because we know that this is a condition. Before, they are not acknowledging concussion, that there is a problem, but now they acknowledge this. Yes, because of the functional MRI, they acknowledge this. Yes, there is changes in brain that we have to treat them properly, so that they can improve their sports, their ability to prevent further injuries.
School or get back to work. So important to get into physiotherapy early, right? Like, don't wait. There are techniques for when it really hurts. There's special techniques. You want to get in as quickly as possible. Tell me, you mentioned ultrasound. What is that, and how does that actually work on somebody's injury?
Ultrasound is actually sound or ultrasonic waves, helps to reduce inflammation, improve reducing pain, improving circulation of the blood. So it's actually changing the electrical energy to this sound energy, and helps in reducing inflammation in tendinitis, bursitis, or any type of joints, sprain, strain conditions. I usually use like acute conditions where there is inflammation, and that is swelling, edema. So it helps in reducing the inflammation and swelling. Then so that we can do other like and the rehab part to strengthen and mobility and other things. That's how it is a very effective modalities. Definitely.
Plantar fasciitis, you use ultrasound on me, and it's used on, like, from your feet to your knees to your shoulders, right? All different.
Yes, because in plantar fasciitis, like, it also helps in breaking the scar tissues. So that's how, when it's become tendinitis and a little bit of chronic, the scar tissue formation is there. So it helps to break the scar tissues. It also prevent accumulation of the scar tissues. So yes, that's also definitely effective in that.
So patients who don't know what ultrasound is, it's a little jelly, like it just a cream, almost jelly, you put on the joint, and then it's very, very gentle. You barely feel anything, just instrument that is literally rubbed gently on the area. So it is something that is extremely gentle, does not hurt.
Definitely.
Results. Now, how does interferential current, or IFC, work, and when would you use it?
Yes. So we all know, like, people like TENS machine, they get it. IFC is also a type of like muscle stimulating current, but the difference between this IFC and TENS and other is our skin has a little bit of resistance, right? So when we use any current, so that it resists to go inside. But because in interferential current, what happens, there's a little bit of higher frequency that other. So because of the higher frequency, the skin resistance, or we say impedance, is less. So it penetrate easily. So that will be less painful to the skin. So that's why with interferential current, we can cover more areas with low painless, like no, you can say like soothing to the skin. But basically it helps in reducing pain, improving circulation inside, in inflammation. It will helps in reducing edema. I prefer those in like acute conditions to reduce inflammations, reduce edema, as more with other, or if I have to cover a larger areas. Especially in acute condition, if we use TENS, it's more painful because if you increase the intensity, it will be more painful to the skin. In that conditions, IFC is very effective. It's like the same, like 4 electrodes pads on the skin. It feels like tingling like sensation. I always do assessment before applying the interferential current, so I know exactly where to use, in which condition we should not use. It's very safe, almost no side effects on that. Yeah, so it's a good modalities, definitely. Yeah.
The joint. I know when I had the plantar fasciitis,
Yeah.
the ultrasound on me, you worked on my ankle mobility, you worked on my,
Yeah.
but then you chose to tape my Achilles and my arch.
Mhm.
When do you decide, and what joints can you tape?
Yes, taping is one of the very effective accessory technique with that. What do you mean by accessories means, like say plantar fasciitis, we release plantar fascia, we release the gastrocsoleus muscles, then definitely we use ultrasound. But what if after that, then you go and you do your work, or the sports person will go do the sports person running, or then how we protect, again it will stretch the plantar fascia there. So to prevent the extra stretch, because of the like stretching, that can again affect the joint, it can injure more. To prevent that, we use the taping. I use the taping in all the acute shoulder injuries to prevent further injury, and also knee, all the knee injuries. I do some of my patients say, oh, we do need to train because this season is going on, we can't stop. Then what? So I do tape them. I just tell them, okay, come see me before your game, or before your 1 day before. So I tape it. You can keep it for 2 days. That's fine. But at least it would give you a stability to the joint. It would prevent further injuries. In that way, it is really effective. Yeah.
Great. And what kind of exercises do you do? Do you do at the office? What kind of exercises or stretches would you do with patients?
Yeah.
This is what you would send home.
Yes. So the exercises are very different. Like one set of exercises, as you tell, like for the home-based exercises, always the exercise starts with the very first day, depending on the conditions. First, the exercise is to maintain some exercise to maintain the strength, some exercise to increase the mobility of the joints. So I do it like progressive exercise planning, very personalized depending on condition to conditions. And then once the patient gets better, it's more like strengthening, then balance, then like more like sports specific exercises, depending on what is the need of the patients, what he's doing, what is activity level. Based on all these parameters, I decide and progress the exercise according to that.
And it's been awesome because we've worked together for
Yes.
patients with frozen shoulder, and I'll work with the nerves in the neck that will go to the shoulder and down the arm.
Yeah.
But then you'll work with the actual rotator cuff and the actual joint to give them their home exercises. And we've done the same thing with patients with severe arthritis or disc injuries in their lower back. They'll adjust it, get the alignment done with a chiropractor, but then get the the specific home exercises for the acute injury or chronic injury, and then for what they have to do at home, which is great. What's a typical treatment plan with you? Like how long is it? How long is a treatment? How long is an examination? And how long, how long would patients be seeing you, or how often would they be seeing you?
Yeah, that's a good question, actually. So we have like initial treatment, initial assessment. Initial assessment is usually 1 hour sessions. So what exactly one expectations from 1 hour session is first we'll start with like history taking, then special tests, then knowing the what is the problem, voice structure get exactly involvement, then deciding what treatment would be the best for those problem or condition. Then I do treatment as well. After the assessment, I do the treatment. Then after the treatment with the patients, I do plan the following session. How would be the following treatment plan? Okay, that we all decide in the very first day. Usual my treatment session, depending if it's like a sports conditions, injuries, it's like 4 to 6 week plan. Usually soft tissue takes 4 to 6 weeks to heal. So 4 to 6 week plans. So that is the acute state of first stage of the injury. Then once they fall better, get better, then after that we go to like rehab phase. Then it depends on patients and me, how we decide, maybe once a week or once in 2 weeks, maybe 4 weeks more, depending on how fast their improvement in that way. Then, so this is the initial assessment, we decide all this. The following treatment session is usually 30-minute session. In 30-minute session, we do mostly treatment. And after the treatment, I review the exercise plan. I always teach them the exercise and ask them to perform the exercise in front of me so that I can see that whether they're doing those exercise properly or not. That's why every time they come to see me, I review the exercises again and progress some exercises, add some new exercise or home-based exercise plan. That's how we progress, yeah. And depending on the condition, as I told you, like sports injuries usually 4 to 6 weeks. Let's say it's plantar fasciitis, it's like I usually plan it like 6 week plan in the beginning. Some patients do take more, but usually 6 weeks my patients feels better. Then I treat them, tell them exercise program, stretching up gastrosoleus, stretching up the plantar fascia. They continue at home, they get better. Yeah, that's how we progress. Yeah.
And the amazing part, and the reason why I like having you on the team, is that it is custom one-on-one. It is not
yes
5 people in a gym and the physiotherapist walks around and checks on everybody, but it's actually seeing 5 people at the same time. Your treatments are one-on-one. There's nobody else in the room. You're not on 2 people or 4 people. It is all customized one-on-one, and then the person can go home and do their home exercises or go to their own gym, but be able to do stuff on their own. But the work at the office is hands-on, one-on-one, which is very different than group physiotherapy or OHIP-based physiotherapy.
Exactly, yes. No, definitely. One-on-one is because it's customized, it's exactly what patients need. And sometimes patients, different people, different personality, the different lifestyle, that matters a lot when you're programming an exercise session or exercise plan. So in that way, it is really effective one-on-one. Yeah.
The other part that I really like about it is that you're not hiring a student to do the work for you and then overseeing it. And in many physiotherapy clinics that I've been in, they have a physiotherapy assistant, which is essentially a university student who's not as educated, do the work, and then the physiotherapist delegates to that work. This is all hands-on, done one-on-one with you, which is what I like. Now, give me an example. What's your favorite case? Like, what do you really get passionate about helping people with?
As I told you, I usually see all type of patients. There's no doubt on that. Like, I love sports injuries. I really love what I do. So I really love to treat like sports injuries, love to do vestibular rehab, all those things, definitely. But I like challenging cases, as I told you, like chronic cases. Let's say frozen shoulder. Frozen shoulder patients used to love me because they usually have so much pain in the beginning, then so much restrictions. So with my all hands-on techniques and everything, I try to reduce the pain. I try to increase their mobility, like faster than before, like as there were so much pain. So I like that way. So definitely on the hip cases, hip arthritis is very painful, very challenging. because pain stays for long, and it's difficult to walk, difficult to move, because it's a hip. Although you're standing, you are doing lower mobility activities, whatever. Hip is one of the most important joint, because the body weight is a huge muscles, is maintaining your balance. So it's a very challenging as well. So but I like that way. The hip arthritis or frozen shoulder, I love to do that, but I do treat all type of conditions. Yeah.
And what kind of COVID protocols do we have in place for you? Like, what are some of the specific protocols that, as a physiotherapist, that you have in place for COVID?
Yeah, definitely. Things have changed in these COVID conditions, and we are very diligent maintaining hygiene, cleaning after each patient. We clean all the equipments, we clean the tables, we clean all the like modalities, everything. Then personally, I use mask, head shield, and we, even before entering to our clinic, we do take a questionnaire to know whether, based on all the standard protocol, we do take the questionnaire to know whether the patient has any COVID conditions or not, or any symptoms. We are maintaining all those government guidelines to keeping our patients healthy and keeping ourselves healthy as well.
Some of the things that we have, the COVID screening done for the email that comes out text prior to even a person entering the office. So the office
nice
environment. We have it as the screening. There's a questionnaire that you fill in at 4 different stations, plus hand sanitizing before going in, right away before going into the treatment room with Sacchi. And then, of course, Sacchi's doing all the cleaning and working inside. We have the social distancing set up. You will see our wall of cleaning products and paper towel to keep the office clean. And then also, even in the back office, we have to have the proper ability to wash the towels, the cleaning, that we had to buy a new second hot water tank, and all different containers to keep the laundry now in sealed containers, to make sure that everybody is safe and comfortable, both the staff, the physiotherapists, the doctors, as well as our patients. So certainly lots and lots of protocols, and you will see that it is a very, very safe and comfortable environment. And definitely we're seeing people with anxiety, stress, that heightens their injury, heightens their pain. So we're there to support you through that as a team. So certainly, I've seen lots of patients that we've sent together or worked together for osteoarthritis at the hip or bursitis at the hip, throwing injuries for baseball or swimming injuries, hockey injuries. But our goal is to really work together. So excited for you to be on the team, helping with arthritis, our vestibular concerns, our dizziness concerns, our balance concerns, the arthritis and the concussion. So great stuff. Is there anything you'd like to add that you'd love to? I know you're so passionate, but what else is there anything you want to share with people about physiotherapy?
Like as recently as I did a new course on GLAD program. That is a very specific evidence-based exercise program on arthritis. It's a Good Life program in Denmark, but they brought to Canada as well. I did that to be, yes, GLAD, GLAD for arthritis. So I recently did that to improve my knowledge of the arthritis exercise plan. Hopefully in future we will start in the clinic as well. But I think that way I can help more arthritic patient more effectively.
That's awesome. Amazing that someone's passionate about what they love to do when they want to keep learning. You already heard from Sacchi that he took vestibular training, he took concussion training, he took the GLAD arthritis training. So always ongoing his skills to keep getting better. And you'll see me always going to upgoing and upgrading seminars along with Dr. Blake. And when everything's getting better, there's more information every single day. So as doctors, as practitioners, we've got to keep learning, and we're committed to that at the Justine playing well. So that's awesome. Well, Sacchi, we are excited. We're happy you're on our team. We're
Oh,
happy
thank you.
you.
I'm happy to work there as well.
Patients
Very excited to see my patients there. Yeah.
And if anybody wants a chance to meet Sacchi, to do what's called
Mhm.
a consultation, a meet and greet, a
Yes.
5-minute chat, to ask questions how physiotherapy can help you, that is free, okay? It's a
Yeah.
5-minute chat just so Sacchi can explain what it is. Make sure you're comfortable. You can see the room, that it's
Mhm.
private, it's clean, you can feel comfortable.
Yeah.
That is free. If you are super nervous with this COVID going on, you can also do a phone call or a
Yeah.
FaceTime just to
Yeah.
see the environment, make sure you're comfortable. We want to do everything possible to make sure that you
Mhm.
have the opportunity to see our team members, our physiotherapist, Sacchi, our chiropractors, our massage therapists, our naturopaths, our holistic nutritionists, our acupuncturists. So we're here to work as a team. The
Yeah.
consultations, they are free. They can be done virtually if needed. So definitely give us a call. You can see the office phone number there at 905-840-9355. And as a team, we're here for you. These are tough times.
Yeah.
And this is not when you want to be hurting. This is not when you want to be suffering. That's going to, with stress, we know, lowers all function in the body, your immune system, your ability to manage stress. So definitely this is a time, make that call for a consultation, ask how physiotherapy can help you. So we're here for you, and keep staying in touch with all of our talks coming up. We still have the master series going on creating your defenses. That's on Monday nights, and it will be up all through the month. We also have our upcoming wellness talks on anxiety, on inflammation. So you're going to be seeing numerous upcoming talks, one on fibromyalgia. So stay tuned, stay connected, and let us know if there's something else you'd love us to share with you, to learn more about. And we'll make a talk on that, because we're there to help, and these are free. So please pass these on to friends and family, even if they don't live local. This is there to help you. So everybody have a wonderful night, and we look forward to being in touch with you soon.
Yeah. Thank you.